figured it was a good idea to do an update on Aidan Hutchinson's injury after we got a little bit more information. He ended up fracturing that tibia and that fibula, and he got emergent surgery done. And I talked about them possibly putting in a plate, and I got some feedback that they'd likely done a nail instead. So I decided to do a little bit more research because, as most of you know, I'm not a surgeon. I'm a non-operative sports medicine physician, so I do closed reductions that don't require cutting the person open. I do injections into joints, into the spine, and I do just non-operative treatment like that. But I did have a partner who is one of the best joint orthopedic surgeons in Michigan, Dr. Eddie Al Youssef, and I got some insight from him. So Hutchinson ended up having a comminuted fracture, which means that it's broken in multiple places. We talked about how if it's extremely distal, meaning at the far end of the bone, that a plate is the mechanism of choice to repair, but it rarely is that distally fractured when you have a tib fib fracture. Usually it's in the mid shaft, as shown up here, or the distal mid shaft, which I think is more so where Aidan Hutchinson's was. The reason why you would do this intramedullary nail instead of that plate, as we showed before, is because you don't have to do it in a significant open way, which exposes a lot of the soft tissue, which preserves the good blood supply and also allows you to weight bear a lot earlier. Other issues with all those broken pieces, it's kind of hard to put it together in an open repair. It's kind of like putting a jigsaw puzzle back together. But with the intramedullary nail, you just shoot it through there and you avoid all that busy work. Even though that fibula was fractured, it's rare that they'll put a plate in there unless that syndesmosis is also injured. Otherwise, usually the fibula being fractured doesn't really change the outcome of the surgery because it's responsible for such little weight bearing. It's like 5 to 15% weight bearing, and the tibia is more responsible for the majority of the weight bearing. So I talked to two orthopedic surgeons that take a ton of trauma call, and they both tell me this is not even close to a career-ending injury. He will be back in about a year, and it'll take him about half the season to ramp up after that. But Aidan Hutchinson will be back and comeback player of the year.